bombshell new analysis by Age UK highlights the staggering cost of delayed discharges from hospitals due to a lack of social care in the community. Councils are struggling to provide social care for millions of elderly Brits because their budgets have been slashed by billions of pounds by the Tories. The short-sighted cuts mean hospitals cannot discharge patients, even though they are ready to leave, because there are no local social care beds. The report also warns that the number of older people in England who struggle without the help they depend on to carry out essential everyday tasks such as getting out of bed, going to the toilet, washing and getting dressed has soared to an alarming new high of 1.4 million. It means nearly 1 in 7 older people now live with some level of unmet need. Age UK calculated that delayed discharges from hospital due to social care not being in place costs the NHS £289,140,954 a year, equivalent to £550 per minute. Carolyn Abrahams, charity director at Age UK, said the new report showed the huge impact on older people and on the NHS of our wholly inadequate system of social care. She added, Age UK's new analysis shows that delayed discharges due to a lack of social care is costing the NHS a staggering £550 every minute. The extra funding announced recently for the NHS is warmly welcome, but it will do a lot less to help our GPs and our hospitals than it should do for as long as the government allows social care to continue to decline. The government often says they have invested more in social care over the last 2 years, but it's not been nearly enough since the numbers of older people going without the support they need are continuing to rise and quite sharply. Responding to the report by Age UK, Cllr Izzi Seccombe, chairman of the local government association's Community Wellbeing Board, said people's unmet care needs will continue to increase and deepen the crisis in adult social care unless the sector receives a long-term funding settlement like the NHS and further funding is made available for councils' public health and prevention services. To prevent crises in the NHS, government needs to plug the £3.5 billion funding gap facing adult social care by 2025 and reverse the £600 million in reductions to councils' public health grants between 2015-16 and 2019-20.